I'm Marina Terasova, and welcome to My Happy Thyroid, your source for all things thyroid health and wellness. My Happy Thyroid is presented by Paloma Health, the first online medical practice focused on living well with hypothyroidism. I will be talking to you today about Hashimoto's disease. If you're listening today, you're probably on your journey to find out more information about hypothyroidism and Hashimoto's. During our last episode, we talked about how to best advocate for yourself as a thyroid patient. And we talked about one of the best keys to doing so with your doctors and other providers is really to educate yourself on better understanding the disease so you can have more informed conversations with your healthcare providers. So today we'll go deeper on Hashimoto's disease, which is the main cause of hypothyroidism in the US. Let's dive into today's topic of Hashimoto's, often also called Hashimoto's thyroiditis. It's an autoimmune condition that attacks your thyroid gland. So it's your immune system ramping up against what it considers a foreign body. And autoimmune disease works that way. It depends where your immune system focuses on which condition you have. So in the case of rheumatoid arthritis, your body attacks the synovial fluid of your joints. And in the case of Hashimoto's, your body is actually attacking the thyroid gland. So it's recognizing your thyroid hormones as foreign bodies, and it sort of ramps up your autoimmunity to attack the thyroid gland, causing it to underact. And it's so, as I mentioned, this autoimmune condition of Hashimoto's is the most common cause of hypothyroidism in the US. And Hashimoto's affects roughly 5% of everyone in the US. And that's correct. So if you have Hashimoto's, you very likely also have hypothyroidism. You may have subclinical hypothyroidism. So your thyroid may not be underactive yet, but it is likely that after a long period of immune activity against your thyroid, if it's not underactive yet, that it will be in the future. So it's really important to monitor your Hashimoto's antibodies, which are known as TPO antibodies. Let's talk a little bit about the history of the disease. The Hashimoto's thyroiditis is named after a Japanese physician named Hikaru Hashimoto. He was around from 1881 to 1934, and he went to the medical school in Kyushu, Japan. And he first described the symptoms of persons with stroma lymphomatosa. It's an intense infiltration of lymphocytes, and he found them in the thyroid in 1912, and he published it in a German journal. And that's the history of sort of the first identification of Hashimoto's disease and how the etiology of it. Now, in 1957, so it took almost 50 years for Hashimoto's to be recognized as an autoimmune disorder, and it's the first autoimmune disorder to be the first organ-specific autoimmune disorder. So now we know that there are autoimmune disorders associated with your colon, with your gut, with your joints and your skin. So there's been a number of others found after Hashimoto's. So what's happening to you when you have Hashimoto's? When you have the disease, some people may actually be asymptomatic for a long time. So a lot of people are surprised when they test their thyroid and they have autoimmune markers. But a lot of people feel the symptoms pretty significantly. So when your antibodies are attacking your thyroid gland and your thyroid does become inflamed and overworked, it generally leads to a hypo state. So the symptoms of Hashimoto's can be very similar to those of hypothyroidism. While research is somewhat inconclusive about why your body may overreact to your thyroid, studies do point to things like nutritional deficiencies, leaky gut, damage to your pituitary gland. Some medications can cause your immune system to attack your thyroid, and large hormonal events like pregnancy, menopause, labor and delivery, and also family history are really the most common reasons for Hashimoto's. And the main philosophy out there is leaky gut syndrome and gluten or other things leaking from the gut and getting into the bloodstream. Now, gluten, what's interesting is the the molecule of gluten is actually very similar to thyroid hormones. So if your body is sensitive to gluten in your body, and it sort of notices gluten leaking from your gut into the bloodstream, it's going to start to sort of say to attack this foreign object of gluten in your blood. And consequently, in many of those cases, your body also may start to recognize thyroid hormone, which looks a lot like gluten, and start to attack it. And that is the most, in very simplified terms, the most common sort of etiology of thyroid, of Hashimoto's, and how your immune system starts to attack your thyroid. So it does have to do with diet, and that is right now the main sort of prevailing way of treating hypothyroidism, although there are several. And we can talk about that. And Paloma's nutritionists and endocrinologists, thyroid doctors are well versed in talking to people with Hashimoto's about what options they have for treatment. So let's take a step back and talk about the symptoms of Hashimoto's. Early stages of Hashimoto's disease, like I said, may not cause any noticeable symptoms. So people may be symptom free. And then as the disease progresses and more of the thyroid becomes involved, they basically become more hypothyroid. So symptoms are very similar to hypothyroidism, that is just garden variety hypothyroidism. People may have an enlarged thyroid gland, which is also commonly known as a goiter. They may feel increased sensitivity to cold. They are commonly very fatigued. They have sluggishness, their voice may become hoarse. Skin is affected. It may become dry and more pale than normal. Constipation is a common symptom. So basically, the body's slowing down. Hair loss, brittle nails, difficulty getting pregnant, fertility is really affected with underactive thyroid, and a whole host of other symptoms. So depression is another one that I shouldn't forget to mention. So yeah, the list is very similar to a list of just hypothyroid symptoms. And a lot of our Hashimoto's patients don't know that they're Hashimoto's. They think that they are just regular variety hypothyroid. And we help them by testing their TPO antibodies understand that they're actually having an autoimmune reaction to their thyroid. And it's really important to know that and to test your autoantibodies, because there are other things that folks with the autoimmune version of hypothyroidism, with Hashimoto's, can do to treat that condition. So now let's talk about who is at risk for Hashimoto's disease. So one of the most affected groups is folks that are getting up there in middle age. So age is a risk factor for Hashimoto's disease. The second most affected group are women. So women are 7 to 8 times more likely than men to develop Hashimoto's. Isn't that fun to be a woman? All these autoimmune conditions and thyroid-related disorders are much more common in women. It has to do with the hormonal nature of thyroid hypothyroidism and autoimmunity. So women are not lucky in this department. Radiation exposure. People who have been exposed to high level of radiation on their thyroid are more prone to developing Hashimoto's and autoantibodies to attack their thyroid. And it's hereditary. So if other family members in your family have Hashimoto's or other autoimmune disorders, the risk of developing Hashimoto's goes up. And for those with other autoimmune conditions, you're also blessed with a higher risk of developing Hashimoto's. So folks with RA, type 1 diabetes, lupus, Crohn's disease are also, unfortunately, more likely to have more than one autoimmune condition, including Hashimoto's. So it's really important to monitor yourself and take steps to sort of reduce your autoimmunity in your body. Let's jump into the complications of Hashimoto's disease. So, what happens if you let it go untreated? Now, if you just have high TPO autoantibodies, some doctors and practitioners don't believe in treating it if there's not other symptoms. So, that's probably a whole other episode on its own. But let's talk about the complications of Hashimoto's disease if you do have underactive thyroid. So, if your thyroid is known to be underactive because Hashimoto's, it can lead to a number of things. So it can lead to a goiter, which is an enlargement of your thyroid gland. And in Hashimoto's, with Hashimoto's, it's one of the most common causes of goiters. And goiters usually aren't painful. They can sometimes, people can feel it when they're swallowing. They can alter your appearance or cause some breathing and swallowing problems. So, and they're also, it's showing your body showing the system of symptoms of an inflamed thyroid. It generally isn't dangerous on its own. It's just more of a symptom of the condition. Um, Mixed edema is the really severe form of hypothyroidism. It's when it goes untreated for a very long time. It can cause drowsiness that progresses to really profound lethargy and really land people in the hospital if they become unconscious. They can go into a coma, and it can be triggered by sedatives, infections, a cold, or other types of stress on the body. So mixed edema can be life threatening. This is what you want to avoid with hypothyroidism. It requires emergency medical attention. That's what people end up in the hospital for with hypothyroidism. It's really important to treat your thyroid and not let it go underactive and untreated for a long time, because it can lead to mixed edema. Other things to watch out for with untreated hypothyroidism, it's mental health issues. So depression can start at even in the beginning stages of Hashimoto's disease. A lot of times when people don't know they have Hashimoto's or hypothyroidism, the most profound symptom they feel is a depression, and they can start being treated by a psychiatrist, taking antidepressants, and not know that it's actually linked to their thyroid. It may take many years to actually uncover that. Other mental health issues include decreased libido, cognitive functioning, sort of a brain fog, difficulty with short and long-term memories. That's all caused by an underactive thyroid. And then lastly, fertility and birth defects. So we know that with low-acting thyroid, it may be harder for women to become pregnant. If they do become pregnant, it's actually very important for pregnant mothers to monitor their thyroid levels to a very precise, within a very precise range. It's much tighter than the normal range. And thyroid hormone actually makes sure that children don't have any sort of birth defects. So children born to mothers with untreated hypothyroid disease, like Hashimoto's, they're at increased risk for some developmental issues, birth defects such as cleft palates, and other heart and brain and kidney problems. So if you are pregnant or considering becoming pregnant and you have Hashimoto's or just a regular underactive thyroid, please work with your OB or an endocrinologist who will make sure to monitor your levels every month and make sure that they're ideally below 2 or whatever your doctor thinks, but it is a much tighter range than what is normal for the regular person. And if doctors take their time to understand the patient and address all their frustrations, they can take many steps to relieve the unhappiness of their patients and potentially improve their quality of life. And of course, treating your hypothyroidism to the guidelines will help prevent many of these complications. There's, some people say there's different stages of Hashimoto's disease. We'd like to talk about some of the stages. There's 7 stages that we believe exist with Hashimoto's disease. The first is sort of the initiation of the disease. Here, your thyroid is still close to fully functional. You'll likely experience few to no symptoms, and you may not know for many years that you have these autoantibodies kind of starting to attack your thyroid. And it may take several years from here for symptoms to appear. So if you're here and you do discover that you have antibodies, it's just important to follow a healthy lifestyle, healthy diet to help you prevent further autoimmune activity against the thyroid and prevent disease progression. After initiation, at some point, the disease goes into expansion. At this stage, you might start to feel a few early symptoms as your immune cells start working faster and kind of start to kind of have a bigger impact on your thyroid gland. If your doctor runs your standard TSH test at this stage, it may not likely be elevated. You may want to also test your free T3 and free T4 to see if they're low. And of course, you want to test your TPO auto antibodies to sort of see what level your TPO antibodies are. Now, I'll just take a little aside here and note that your TPO antibodies can actually fluctuate from day to day and even within the day. So TPO auto antibodies are really triggered by stress and by diet and by other health conditions. So once you have Hashimoto's and an activated autoimmune response to the thyroid, there's not a lot of science saying that, what the numbers should be. It's just important to know that they're out of range. But there is more and more science around that. It's just not fully developed to help one understand if your TPO antibodies are over 1,000 or 60, what the difference is and it can really vary in each person from day to day. So it's just important to note that in case you see your lab results vary in the number of TPOs. We have patients contact us about that all the time. Last time I took my test, my levels were 20 and today they're 60. It's actually super normal to have that variation in TPO antibodies. And it's important to monitor because you can say to yourself, on a day that my thyroid was elevated, if you look back at your diet and what you were feeling that day and how much stress you were under, perhaps you can start seeing correlations there and, take steps with your doctor or nutritionist to address what's driving up your autoimmunity. After the expansion of the disease, Hashimoto's can go into a full-blown disease. It's in this stage that you'll see notable changes in your TSH values. Your doctor may prescribe thyroid hormone replacement substitutes or begin regular monitoring to watch for TSH deviating from the normal range. Here's where you'll start to do regular blood tests, see your doctor regularly, and make sure you're on the right level of thyroid hormone. Most commonly, people are prescribed pure synthetic levothyroxine or T4. You take that every day by orally, and that fully replaces the thyroid gland. And it may take you and your doctor a few times to figure out the right dose for you and whether levothyroxine or the generic version of it is the right medication for you. For the patients that do not feel completely normal taking the synthetic preparation of T4, it depends on the labs and the patient and doctor preferences, but doctors may add on synthetic T3 or a compounded version of the two. Lastly, medicated Hashimoto's. Or not lastly, but the next step is to medicate the Hashimoto's itself to compensate for the loss of thyroid function. Here, your doctor may actually increase your dosage of your levothyroxine or whatever medication you're on. You'll work with your doctor to tweak the dosing that's right for you. People are unique in what they're sensitive to and what our bodies respond to. So it's really important to find a doctor that will work with you to find the right medication for your condition. And the goal is to get you feeling well with your lab results, but also your symptoms here. There are a few agents that some doctors have started using. It's off-label, but drugs like LDN, it's called low-dose naltrexone. There's data to show that they may reduce autoimmunity for certain conditions. There's limited data in Hashimoto's, but some doctors have started to try LDN for some patients to reduce the TPO antibodies and to reduce the autoimmune response to the thyroid. And it's a mixed bag with LDN. Some patients respond really well, and for some patients, it doesn't quite work and it causes some uncomfortable symptoms. The next stage is reversion. Now, this doesn't happen for everyone, and some people will never reverse their autoimmune disease. But some people can manage it, and we talked about managing it with lifestyle and some dietary and lifestyle factors. And some people actually, through those actions, actually see a lessening of their autoimmunity and their impact on their thyroid. Some people are able to decrease their thyroid hormone reliance, so they may decrease their dose of synthetic T4 that they take. They may decrease the number of supplements they have to take after a certain time. Some people actually, their thyroid returns to normal. Now that's not in the majority of cases what happens, but we have seen that happen. So some people actually can get off their thyroid medication altogether, which is very nice. And Paloma is working on methods to try and figure out what the secret sauce is for everyone to do that. But it's not a goal that, we can say happens for the majority of patients. But some people, like I said, do see a lessening of medication that they take, symptoms decreasing after adopting the right treatment plan for them. And then finally, the last stage we want to talk about is really prevention. So if you don't yet have Hashimoto's, but you're at risk for it, just maintaining that prevention. So there's no cure for Hashimoto's, but proactively monitoring and adjusting your treatment plan and making sure you're um, monitoring your TPO auto antibodies, that you're taking any precaution that you can with diet, lifestyle, healthy way of living to try and prevent the onset. Um, and you can talk to thyroid doctors and nutritionists about that as well. But it's critical to, if you don't yet have the condition, to try your best to live a healthy lifestyle through all of these things that we discussed. And other things that your doctor or nutritionist may walk you through to help keep you feeling your best each day. So there you have it. That was a little crash course on Hashimoto's disease. We talked about knowledge being the best first step in controlling your disease and being your best advocate with your provider. We hope you have a stronger understanding of what Hashimoto's disease is and how it's the number one cause of hypothyroidism, and how to treat it, how to prevent it, and what you can do, what questions you can ask your doctor and provider if you are affected by Hashimoto's. We'd love to answer any questions. Feel free to reach out to us at contact@palomahealth.com if you have any questions about Hashimoto's and how it's treated. And again, we'd love to welcome folks that are interested in testing their thyroid function to see if they do have Hashimoto's. We would love to direct you to palomahealth.com/podcast and offer you a 40% discount on your at-home test kit. And what happens there is you would get your results via email after you send us back your sample, and we would tell you if you have underactive thyroid caused by Hashimoto's disease. So hopefully this was helpful. Again, I'm Marina, your host of My Happy Thyroid, and we're excited for our next podcast where we're going to have a thyroid yoga guru joining us in just a couple weeks. So stay tuned for that, and thank you so much for joining us today. My Happy Thyroid is presented by Paloma Health, the first online medical practice focused on living well with hypothyroidism. You can go to palomahealth.com to learn more.